Hi, I'm Dr. Sam Dubé. I'm here to talk to you today about bunionettes, also known as Taylor's bunions, their symptoms, their underlying cause, and the benefits of different treatment options. The symptoms of a bunionette are pain and swelling at the base of your pinky or fifth toe. What causes bunionettes? Well, bunionettes are often caused by a combination of excessive foot movement or long-term use of excessively narrow and rigid footwear. A bunionette presents as an actual enlargement of the bone. When the foot overly pronates, excessive torsional forces are created throughout the metatarsal bones. These torsional forces through the fifth metatarsal result in an excessive rubbing of the lateral edge of the metatarsal head against the shoe, which creates intermittent pressures and friction that result on the formation of the bunionette. The change in the size and shape of bones is accompanied by damaging soft tissue stress that becomes inflamed and painful. For proper function, our feet require the right stimulus and the right movement. Right stimulus consists of the subtle varied stimulus that the soles of our feet receive when we walk, especially when we walk barefoot on natural terrain. With each step, there are subtly different sensations. These subtle differences in stimulus keep our brain on high alert so that our body's protective reflexes function properly with optimum muscle function. When our brain is uncertain about what will happen, it triggers protective reflex muscle activations that support our arches before our feet contact the ground, to ensure that our feet and legs can safely manage the forces generated by the activity intensity of our bodies. As activity-related stimulus intensifies, a progressively higher arch is created. That's why, when they are functioning properly, our arches and toes rise and fall dynamically in response to the varying activity stimulus intensities. This uninhibited dynamic movement is right movement. Right stimulus and right movement prevent excessive pronation. Conventional footwear impairs optimal foot function in two ways. First, most conventional footwear dampens right stimulus. This is particularly true for shoes or insoles that support or cushion our feet. They spread the forces evenly across the soles of our feet, creating sensory input that's muted and repetitive, step after step. Within a short period of time, our brain tunes out the stimulus and stops responding to it. As a result, our brain doesn't sufficiently activate the muscles that stabilize our arches and properly align our feet, legs, hips, and lower back before our feet contact the ground. This tuned out brain response is natural and happens all the time. The same thing happens when we walk into a room and first smell coffee. Then after a few minutes, not notice the smell at all. Second, most conventional footwear, especially footwear that's tightly laced, has snug toe boxes or stiff midsoles or outsoles. Restricts the right movement dynamic raising of the arches and toes that is critical in the creation of a strong, stable arch system. Wearing footwear that dampens right stimulus and impedes right movement can create the damaging stresses that cause a bunionette. Conventional treatment methods for bunionettes include taping or stabilizers, supportive products such as orthotics, modified footwear, and surgery. While these methods may temporarily alleviate symptoms, they don't address the poor neuromuscular function that is the cause of the problem. In fact, the more we artificially support or cushion our feet, the weaker and the more dependent we become on these types of products. These old school support and cushioning treatment methods are not recommended in any other area of musculoskeletal medicine as a viable long-term treatment option. In fact, today's modern treatment methods for poor neuromuscular function focus on increasing mobility, muscle and strength, and proper alignment via proper technique exercise, which requires both right stimulus and right movement. Science has shown that simply challenging the body to do its job is the best way to restore and enhance function. This principle is the foundation for virtually all of today's sports training and rehabilitation programs. To address the poor neuromuscular function that causes bunionettes and to prevent them from reoccurring, I recommend walking barefoot on natural terrain as much as possible, This provides the optimal right stimulus and allows for the right movement required for healthy neuromuscular function. To obtain right stimulus in your conventional footwear, use BioPod stim soles in loosely laced, soft, flexible footwear that allows your arches and toes to rise easily. For optimal neuromuscular function while wearing shoes, use BioPods footwear, which are specifically designed to provide the right stimulus and to facilitate the right movement that optimizes and encourages healthy foot, leg, hip, and back function. Consult with your healthcare practitioner and ask them about employing soft tissue mobilization therapies to address the fibrotic scar tissue that may have formed before using BioPods products.